If you are one of the millions who suffer from allergies across the globe, you know how frustrating they can be. You dread that warm springtime air because you know that it's going to lead to those itchy, watery, swollen eyes, a runny nose that just won't stop, or that postnasal drainage, that mucus running down your throat that seemingly has you coughing and choking and maybe even a bit nauseous. Or maybe it's the sneezing fits and the wheezing. Know that you are not alone. Understanding why your body reacts this way is the first step to finding relief. Hi, I'm Dr. Kara Wada. I'm a holistically minded, board-certified allergy immunology physician. And if you are one of the millions that suffer, I want you to continue tuning in because we are going to talk about what's happening in your body. Knowing what's going on in your body is the first step to helping turn that ship around so you can feel better and feel empowered in taking ownership of what you can do to feel better. Allergies happen when your immune system is on overdrive. Your immune system is your body's protection. It is the way that your body helps recognize things that may be a threat. It also helps our body heal from injury, but it is prone to making mistakes. And when it senses that pollen or pet dander or a peanut is a threat, that's a problem. It's like your body's security system or border guards have gone haywire, setting off alarm bells when in reality, there is no real danger. Let's dig into what happens when your body has an allergic reaction. Our body is initially exposed to that potential allergen. We breathe in pollen or dander. We are exposed to peanut, maybe through our skin rather than through our mouth first. And what happens when our body sees these proteins from the outside world is that it captures it and it brings it back to our lymph nodes. Our lymph nodes are an incredible part of our immune system where a bit of speed dating takes place between T cells and B cells as the immune system cells work to communicate with one another and determine friend from foe and how they're going to have a future response to these particular proteins. In the case of an allergy, the body is creating a memory that is encoded that has this specific flavor of inflammation. And that is through a mechanism called IgE antibodies. Antibodies are proteins that our bodies make. They're made by a type of B cells called plasma cells, and they create a lasting memory so our immune system knows what it has seen before, if that's something we should tolerate or something we should respond to. When we've created an allergic memory, our body encodes that through a specific type of antibody called IgE. And this is where things have gone haywire a bit. Ideally, this memory should be coded as tolerance, right? These IgE antibodies are then created, and they are then expressed and housed primarily on mast cells. These are our body's border guards. They are found in our connective tissue and in all of our barriers. So our respiratory tract, our gut, our skin, our genital urinary tract. We also have basophils, which are similar cells but found in our bloodstream. When we are exposed to that allergen in the future, we have something called cross-linking of these IgE antibodies on the surface of those mast cells or basophils that then signal that those cells should trigger. They should sound the alarm and call in help. They do this by having the basophils or mast cells release substances like histamine, tryptase, and dozens of other chemicals that are responsible for causing our itching, our watering, our sneezing, our wheezing, our hives, throwing up, all of those signs and symptoms of an allergic reaction. It is the release of these chemicals from those white blood cells that is the issue. Now, not all things that trigger mast cells are driven by allergy. I'll have you tune in for a future episode on talking all about all the ways these mast cells can become activated. It's not just IgE. And to add things and complicate things a little bit more, just having IgE antibody does not equal allergy. It is the clinical symptoms of itching, sneezing, wheezing, throwing up, hives, all of those things, along with the presence of IgE that equals allergy. Just having that IgE level alone, either on a positive skin prick test or in a blood level, that is not sufficient to diagnose allergy. You have to have symptoms. Treat the patient, not the labs. You need the two to equal allergy. And this is really critically important because often people will have allergy testing done kind of willy-nilly without connecting it to that lived experience that you are having. And that is critically important because especially little kids, maybe little kids who are prone to being allergic, those kiddos with eczema, like my daughter Josie, they are prone to having more elevated levels of IgE, that allergic antibody, but they may not have true allergy yet. They may be in this in-between zone. And if we pull out those things, those exposures to things like peanut or egg or wheat, those foods that we want to keep in the diet to switch things towards tolerance, we can miss this window. So it is critically important that we put our thinking caps on and be really thoughtful when we do IgE allergy testing, especially in these vulnerable populations, because I have seen, and many of my colleagues have seen, allergy being a result of pulling things out of the diet, pulling things out of our exposure, and not letting our immune system develop that tolerance. So tread with caution, especially with these IgE blood tests. All right, let's talk about allergy symptoms. We're going to switch gears a little bit. We're going to talk more about the itching, the sneezing, the wheezing. Allergies can range from being mildly annoying to seriously scary. And here are a few ways they might show up. Conjunctivitis symptoms, itchy, watery eyes. It's conjunctivitis. It means irritation or inflammation of that lining inside of our eyes. Rhinitis, inflammation of our nose and our sinuses, sinusitis, right? Itis means inflammation. Runny nose, sneezing, occasionally can result in hives if you've had kind of topical exposure, and a longer term kind of allergy of the skin, eczema. Asthma often is also triggered by allergies, not always, but often. And that can trigger wheezing. Sometimes it can trigger coughing or shortness of breath and chest tightness. This is why it's really important to treat both inflammation and that airway narrowing if someone has allergic asthma and asthma in general. Food allergies is when your immune system reacts to a food protein. Food allergies are different than intolerances, which may just cause belly upset, bloating, gas, diarrhea, that have less of the immune system involved. There also are sometimes food sensitivities, and we'll talk about the difference of these in a future episode. So make sure you're subscribed and stay tuned. The most severe reaction that one can have is anaphylaxis. Anaphylaxis is a severe, life-threatening allergic reaction that involves more than one system of the body. These systems and symptoms may include difficulty breathing, swelling of the lips, tongue, or throat, or the airway itself, dizziness, loss of consciousness, and even cardiac arrest. About 20% of anaphylactic reactions will not have any skin symptoms, so may not have hives, may not have swelling. It also can involve throwing up, especially if it's triggered by a food allergy. So if you have more than one system of the body, it is a system-wide reaction that is a severe life-threatening reaction. And the initial treatment for anaphylaxis is always epinephrine, typically injectable, but now we also have a nasal version, Nify, which is just recently approved. When we're trying to find the culprit of what is triggering allergies, that's when, as an allergy immunology doc, I use allergy testing. And as I mentioned before, I do this with my critical thinking hat on. And I always talk with my patients, hey, I'm going to put my Sherlock Holmes detective hat on. We are going to talk all about what you're experiencing. And I'm going to take that information and I am going to try to connect it to what we see on the testing. Does that make sense? Or does it not make sense? If someone tells me, I have seasonal allergy symptoms that get worse every year around the end of April, kind of through Memorial Day, kind of through that late spring. And then I feel totally fine all year round. I don't have any pets at home. And when I do her testing, I'm a little bit surprised because the only thing that's positive is cat. That doesn't make sense, right? I cannot connect those seasonal springtime symptoms with her allergy result of cat. So perhaps she tells me, oh yeah, if I visit a house with cats, I do get symptoms. Okay, that makes sense, right? But that doesn't explain her springtime symptoms. So then I need to go back to the drawing board and we need to come together and think about what might be contributing to those symptoms in spring. The catch is it's probably still the high pollen counts because pollen counts continue to climb and can be irritating to our airway too. More on that. Again, future episodes, stay tuned and subscribe. We have so much we can dig into when we're talking about the immune system. The way that we can do allergy testing, 2 ways. Skin prick tests, which are those little scratches on the skin that requires patients to go off of antihistamine containing medications that have antihistamine effects for about a week or so prior to that visit. Each medication's antihistamine effects last a little bit different length. And so you need to talk with the allergist office to see what their protocols are. We always do what's called a histamine control prick, which is the master key that allows us to know that we trust the testing and that, yes, we expect that testing should reflect the presence or not presence of those IgE antibodies in your body. Now, say you're on some medications that you can't go off, you don't want to go off of. Totally fine in 99% of the cases. We also have blood testing that looks specifically for that IgE antibody itself in the bloodstream. That testing has gotten much better in recent years. And so I use both types of testing fairly interchangeably, though there is some nuance that you pick up over years of practice and studying of this area of science. All right, let's talk briefly about relief. What are your options? So when we come back to thinking about how I think about allergies as an allergy immunologist and as one who's more holistically minded, I always go back to avoidance is our first line of defense. Now, here's the deal. I don't want you to be in a bubble. I don't want you to give away your pets. But if you're allergic to dust mites, getting some dust mite covers, washing your bed linens on hot and drying on hot may be really helpful. Maybe wearing a mask while you're running the vacuum or the sweeper. Again, that can help decrease your risk of exposure to an increased load of those allergens. Now, when we think about pets, there are some specific things. If you're able to keep your pets out of your sleeping space, this can allow for a little bit more time, about a third of your day away from that allergen to allow your body to go into that recovery and repair mode while you're sleeping. We also oftentimes will use medications. So what are some medications and even some supplements that may help decrease those symptoms? Will help keep those mast cells in check, help shift our body from pro-inflammatory to more anti-inflammatory flavor. The mainstays of treatments are things like long-acting, less sedating antihistamines. Very safe, great track record, work really well. Nasal corticosteroid sprays, again, really safe, work incredibly well. And in the head-to-head studies, actually work better than those tablets. Also can think about ways to shift that immune system response over the long term. This is where allergen immunotherapy shines. It helps retrain your immune system, either through injections of what you're allergic to, drops or tablets that go under your tongue, or precision-guided lymph node injections, which speed things up and work really great because they go directly to where that immune system shift is happening. Really, the future of allergy treatment is precision medicine as we think about a personalized approach for you that takes into account your lifestyle, your preferences, your values. All of those things are really critical when we think from this broad, holistic point of view in treating allergies. We can look at genetics. We can look at exposures. We can go through some of those principles of functional medicine where we look through your entire life and kind of see how you've gotten to this point. All of that can be incredibly helpful as we think about that plan forward to help you get better control of the itching, the sneezing, the wheezing, the rashes, all of those things that come along with allergy. Like many of you, my family has dealt with its fair share of allergies. I have an incredibly atopic sister. I have an allergic daughter who had egg allergy and thankfully has outgrown that allergy. But as a doctor and a patient and an advocate for my own family too, I'm constantly learning about how interconnected those internal systems are and how even little choices, like the foods we eat, the environments we create, the exercise we engage in, how all of that can impact our body and can manage those symptoms incredibly well. Remember, allergies don't have to take control of your life. By understanding what's happening inside of your body, and working closely with a board-certified allergy immunology doc, you can find relief and get back to living the life you want to live. Be sure to join my free Facebook group, the Becoming Immune Confident Community. It's a wonderful place to connect with others who are living with chronic inflammation from allergies or autoimmune conditions, where you can connect, ask questions, and learn more. And while you're at it, you can download my Immune System Disorders Pre-Appointment Workbook. It's an incredible resource to help you prepare for that visit with me or with your board-certified allergy immunology physician. I'll link to those resources in the description below. In the meantime, I want to hear, what are your biggest allergy frustrations? What's the one tip or trick that has helped you the most over the years? Share your allergy wisdom in the comments. And if you want more allergy-friendly information, be sure to hit subscribe.